All right, so hello, Alex Zur. Good to see you. I am doing a kind of a quick live here at YouTube. Um, these are always a little bit different. Oh my gosh, wow, lots of people joining. And of course, once again, as I say, Chloe Clevenger would not be alive without Chloe Clevenger. Amy, hello to you. Colette, good evening. Yeah, good evening. It's 5:43 where I am. Melissa, Diane Nelson, um, Claire, 1012, Cheryl is here. So Erica, again, yep. So I decided to do the YouTube live. I was gonna do TikTok, and I don't know, maybe I'll snap and do just 3 lives in a row. Um, so I wasn't actually expecting people to show up. Like I said, I can't schedule these like I want to yet. Um, but in about 2 weeks, I'm actually going to have a schedule. Today's June 2nd, and by June 16th, I'm gonna have my life back. So I'm pretty excited. And Cheryl says, just got a job with Dr. Omalu working as an autopsy tech, and that's great. That's fantastic. I mean, obviously, he's become one of the best known forensic pathologists in this country, maybe in the world too. I've never personally met him. I'm not sure if he's a member of the National Association of Medical Examiners. I know some pathologists in my field, when they get kind of too big, I shouldn't say too big, but when they get very popular, it seems like they kind of distance themselves from NAME. I went to NAME in 2018. I actually spoke there, did a nice lecture. If I could ever get a copy of that lecture, I'll put it up. It was a pretty good lecture. But I did not see him, but I met some of the other heavyweights. I mean, Dr. G and all that stuff. I was kind of hoping to see him, but I don't know if he's a member or not. That movie, I'm sure that you watched the Concussions movie. I was pretty impressed with that. Did not watch it when it came out. I generally don't read and watch pathology related things since that's all I do. But I managed to watch it last year, and I thought it was very well done. Very well done. Thought Will Smith did a good job. And so, yeah, very exciting. We got 13 people here. That's about 12 more than I thought would be here, so that's good. I never have any prepared comments for these lives. I just feel like if you guys have questions that you can ask them, and I'll answer them for the most part. What I would like to do is, when I have lives, is maybe have a topic and then you guys, if you know that it's happening 4 days ahead of time, and I know we talked about this before, but I have not, like I said, I've been so busy, I haven't had time to really schedule these. But I'm looking forward to having a more regular life. I'm looking forward to it. I'm actually starting to see the light at the end of the tunnel with regards to my life. That sounds kind of grim though, because that sounds like I'm literally dying with the light at the end of the tunnel. That's not the case. I'm just finally going to have a relaxed existence, I think. Not so many court cases, not so many autopsies, not so much other work. It's going to be more of a creative element that I'm working on. Happy Friday. Friday, the fact is, I didn't work today, so it feels like a Saturday to me. So I'm not sure I even knew it was Friday. But it's pretty cool because I'm off today, and I don't work weekends anymore. I banned that. We canceled weekends. So Friday, Saturday, Sunday, and then Monday, believe it or not, is my birthday. Monday is my birthday, so I'm actually taking off today, Saturday, Sunday, and Monday. Have I had many autopsies this week? No. I think I had 6 or 5. That's really not very many. On really bad weeks, I'll have 17 or 19. So really not too bad. Getting lots of birthday wishes now, even though it is not quite my birthday yet. But yep, so your son's going to be 8. That's cool. So yes, thank you for the birthday wishes. Let me tell you, what I did today. After many years of wanting this so badly, let me just say, preface this by saying, I bought something that I've wanted ever since I was like 8 years old, 7 years old, 8 years old, 9 years old. It is what I would consider to be a holy grail for things in my life. In other words, if you said there are 5 things that you can get, and you can have any of them, and those are the kind of the holy grails of things that you want, this would be one of them. So I have achieved this, and it doesn't sound like much, but I bought an arcade game. I bought a stand-up arcade game, and it is a Miss Pac-Man cabinet, because Miss Pac-Man is the game that I played the most when I was a little kid. I grew up in the 1980s, and in the 1980s, video games were very, very big, very huge. I mean, it was just so, it was so new, because they're big now, but they were, as far as the culture goes, you had kids that were into video games, and then you had kids that absolutely, weren't. And I was one of those kids that really loved video games. And I used to save quarters, actually save quarters. And, we would drive 50 miles to the nearest arcade, because the nearest arcade was literally 50 miles from where I lived. And I would go in there, and I just had the best time. And it's a nostalgia thing. But yeah, so Holy Grail for me, I got the Miss Pac-Man cabinet, but here's the best thing about it. It's not only a Miss Pac-Man cabinet, the arcade cabinet, actual full-size arcade, not one of those ones you can buy at Walmart. It contains 512 games. So it operates a little bit like a computer system, where you can select the game and then it plays the actual arcade game. So it's something I've been wanting for years, and I finally was able to go do it. It's not here. It's going to be delivered next week. But I have to tell you that this is my birthday gift to myself. And I am beyond excited. In fact, you may never see me again. I may just be doing that for the rest of the year. But yeah, Miss Pac-Man was for whatever reason, I don't know if maybe I played it so much because if you went to an arcade, that game was always there. Take a game like Centipede. If you go to Centipede, not every arcade had Centipede, so why would that be my favorite game? But Miss Pac-Man was. So Diane says, I can't tell you how many hours I spent playing Castlevania on NES. And yes, that was a great game. Here's the funny story. I love that game, and I never beat it. I just couldn't do it. It just wasn't good enough. And I finally beat it literally last year. And I didn't think anyone would believe me, so I recorded the end of it. I recorded the end of me beating Dracula at the end of the game. So yeah, that was one of my life's accomplishments there, was to finally beat Castlevania. All of my greatest accomplishments do not have anything to do with medicine, I think. So this is the longest I think I've ever talked to you guys about not about something that wasn't pathology. Am I a Zelda fan? So that question is that I am a huge Zelda fan, and I am. You can't understand the level of fandom I had for the old Zelda games. Okay, now the new ones have come out. I have bought the new one. I've played it a little bit. But the old Zelda, I mean, that was just an absolute revolution. I was so obsessed with it. I would picture myself in the game, and I was 13 or 14, but I would picture myself as Link. Like I would be sitting at school and I would be thinking about how am I going to get to the end of this dungeon? How am I going to find this certain item? I was obsessed with it. That was Zelda 1. But see, here's one of my most controversial takes in life is Zelda 2. Zelda 2, I love. I absolutely, it's my favorite game, probably on the NES. So a lot of people hate that game, but oh yeah, Ocarina of Time. Somebody said Ocarina of Time. Um, sorry, asteroids go down. Zelda. Okay, so we got Saudi Arabia here. Good. I'm glad Saudi Arabia is here. Um, I don't know that I've had you in my lives before, but hopefully, uh, I'm hoping that my channel is more of an international thing. Um, the American, we got plenty of American followers, but I feel like I have a pretty good relationship with a lot of other countries, mainly through Twitter, but then I deleted my Twitter account. So unfortunately, I don't have those connections with all the folks. I had lots of Saudi friends on Twitter. But yeah, hopefully spread the word, tell your friends, come over here, subscribe, click the little bell so that you get the notification if I'm on. And Claire says Ocarina of Time. So Zelda 1 and Zelda 2, okay, fine. But Ocarina of Time is, I believe, the greatest game ever created. And for some reason, I put those ahead of the recent games. The recent games are amazing, but they're so amazing, they're almost too amazing. Like it's just insane. Like, I don't know, Ocarina of Time was kind of that balance between amazing, but not, but you still felt like you were in a game. These new games are so real. That I don't know. I guess it's hard. It's harder for me to use my imagination when I play the newer versions, and I like to be able to use my imagination. Oh, okay. So we have been. Okay, cool. I'm glad you're an old fan. Erica says I always like Mario Brothers and Super Metroid. So I'll tell you, Metroid is one of my all-time favorite games. Regular Metroid. The first Metroid. That's another game where I felt like I was in another world. The lights in my room would be dark. I felt like I was in those subterranean areas of those planets on Metroid. Super Metroid, I have never played very much of. It's one of those games that I don't know. I just haven't gotten into it. Sorry, I'm getting a text message, so I have to respond to that. Sorry. That's why I have my watch. It's convenient. Mario Brothers. We got Mario Brothers and Super Mario Brothers. I mean, like, the Mario Brothers game was one of my favorites, and then the Super Mario obviously was iconic. And then here's an actual serious question about my job. Has your thoughts on death changed after this job? Not really. I think it's affected my thoughts on life more than it has on death. And what I mean in that is, when you are not a forensic pathologist or an autopsy pathologist, I think you can shield your mind and your eyes from a lot of the terrible things that go on in this world and a lot of the horrific things that people get themselves into. But when you get into this job, it's the rose-colored glasses are off with regards to what's happening in society. You see the tremendous amount of drug abuse. It's so much that you have to wonder how anybody is alive. How does anybody live? I mean, you just get so many bodies every week that are drug overdoses, and they're young people. how does society progress with such an addicted part of the population? The other is that there are people who have zero regard for human life, and they murder innocent people. And so it's very easy to shield your eyes from that. You know, if you're not watching the news every day, you can, life seems a little bit, especially in this country, in my country, um, it's very violent. This is an extremely violent country. Um, and I know that you're in Saudi Arabia. The things are a little bit different over there, but this is a very violent country, and there's a lot of good opportunities here, but it's changed a lot since I was younger. The last 10 years have really been crazy. Just the amount of death that I've seen, the amount of senseless death that I've seen. The other thing is, there's a lot of accidental deaths that are so sad because they just seem so preventable, and they are, I don't know, I once was talking about this on a live, about how unfortunately you see lots of things like children choking on, batteries or like coins or marbles, things like that. And you don't see it a ton, but you see it. And I made this comment about that. And I had someone in my live. It wasn't here at YouTube. I think it was at TikTok, because that's where most of the lunatics are. This person just simply said I was lying, that children do not die from these things. Children do not die from choking or any kind of like accidental type thing. So that is a person who is, because they've never seen it happen, they don't believe that it happens. And so if I had that mindset, life would seem pretty rosy. But when you're in my shoes and you see all of the terrible things that happen, it does give you pause. It also makes life a little bit scary, because when you look around, you see everything that can kill you and anyone that you love. So yeah, I would say that that is my very long answer to your question. Any other questions or comments? We got whales. We like whales. I don't know much about whales. I've had a few pathologist folks that I was friends with on Twitter from there. Seemed like nice people. The World Cup game didn't go as well as I thought it was going to go. I thought it was going to be an easy win, but it wasn't. But other than that, seems like a nice place. I'd like to visit someday. Any other questions or comments? So the question is, why would you do an autopsy on a kid when the cause of death was evidently choking? Well, that's just it. It's never evident. A parent will walk into a room, and a parent will see the child unresponsive, dead, or wake up and find their child dead in bed. So when you don't know what caused it, you have to autopsy it. And 100% of my child choking deaths have been unwitnessed. It's been a child found dead. And when that happens, you have to autopsy, because what if they were murdered? Okay? So that's why you autopsy those cases. If the cause is evident, like if it's a witness choking at a lunch table or something, you might be able to get away without doing it. Although in my jurisdiction, those would always be autopsied, because they occurred at a school or whatever, or perhaps at a business, and then therefore someone else might be liable. So that's why you have to do the autopsy. Heat or Nuggets? So absolutely Nuggets. I don't really like either team very much, but Heat fans have been not very nice to me, because, see, I was hoping Boston would beat them, and so they weren't very nice to me. So I got to go with the Nuggets. Plus, I like Jokic. So we talked about kidney stones the other day. What is the cause? So the causes are, there are many causes for kidney stones. Some of them are genetic, some of them are dietary. I mean, you've got combinations of things like hypercalcemia, too much calcium, you've got dehydration, you've got other stones that are basically, they arise from a genetic defect. And then there are people who have kidney stones who never know why they have them. They just simply don't have a clue why they came up. And those are frustrating, but those are probably the most common, are people that end up with a kidney stone and we just don't know why. I'm crossing my fingers. I've never had one. But I've seen people who have them and they are on the floor screaming. So I prefer to avoid that if I can. How many deaths on Memorial Day? It wasn't that bad. When I came into work the day after, it was 4. And only 2 of them actually occurred on Memorial Day weekend. The other 2 had occurred prior to that. We know that on one of the guys because he was decomposing, so he had been dead for a few weeks. Sarah Jones, yep. Had them when you were pregnant, so that's rough. That's really rough. So, because that's really tough when pregnant folks get kidney stones, gallbladder, appendix, and I've seen that a lot, where a woman will have to undergo surgery like an appendectomy with a baby on board. I always wonder what effect the anesthesia has. Now, of course, anesthesiologists would yell at me and stab me in the eye if I said that, but you just have to wonder if there's any effect that would have. One story from medical school is, this is many years ago. I mean, we're talking like over 2 decades ago. I was in anesthesia, and there was kind of I wouldn't say it was a prevailing theory, but it was a reasonably well-known idea that older folks who undergo surgery and have general anesthesia sometimes have dementia problems afterwards. They have memory problems and things like that. Now, that's not proven. I don't think that's been proven, but just like you're talking to people in your hometown and they say, oh, grandpa went for surgery and he was never the same afterwards. Well, so I grew up thinking a lot about that. So one time on my anesthesia rotation, I talked to one of the anesthesiologists, and I asked him, hey, is this a thing where like older folks that have surgery have dementia problems sometimes afterwards? Anyway, he went absolutely bonkers, just absolutely raging, screaming at me for even suggesting such a thing. And although I have friends that are anesthesiologists in medical school, friends from medical school that became anesthesiologists, and they're good people and they're very smart doctors. A lot of the anesthesiologists I met during medical school were absolute lunatics like that guy. But yeah, he screamed and screamed and screamed at me for suggesting such a thing. So I can only assume that there was some truth to what I said, because if there's no truth, people don't get mad. Back to video games, Ocarina of Time and Mask of Majora. So I actually never played Mask of Majora. That era, there's actually a kind of a black box area of my life where when I went into medicine, I missed out on tons of stuff. Movies, video games, music, just activities, basically deleted 20 years of my life of enjoyment. So starting in a week or 2, I'm actually going to go back and I'm going to catch up on all the things I missed. So after I beat Tears of the Kingdom, then I'll probably switch and try to do a Majora's Mask type thing. Worse than the birth of your son. Never had them before or since. Well, good. I don't know why you would have had it during pregnancy and then never again. It had to be something chemically going on. So Mike Calloway says, what is your take on person telling Dr. Drew that Jamie Foxx is blind and paralyzed from the mRNA vaccine? Is that even possible? So first of all, let me just say, Dr. Drew has become a little bit unhinged in the last couple of years, the last 5 years. I remember Dr. Drew when he first started. He had his show, super level-headed guy. I loved listening to him. And we're talking, I mean, we're looking at 20, 25 years. I remember listening to Dr. Drew and watching him. and I really thought he was a cool guy. Um, but the last 3 or 4 years has unmasked a lot of issues with some medical professionals and people in general. He has become unhinged. Now, I'm not saying that that has anything to do with what happened to Jamie Foxx, but I know that he is sort of peddling that conspiracy theory. Now, first of all, let me say that I think that that theory is rooted in the fact that Jamie was and his family were very quiet about what happened. We actually don't know what happened. I'll say this: if I had a medical issue that put me out of commission, I don't feel like anybody online or in the world has the right to know what my medical event was. And maybe Jamie Foxx is just one of those people. Maybe he did have a stroke or something like that, and he's like, you know what? I just don't want people to know what happened. Maybe it was something weird or embarrassing. I mean, like for instance, and I'm not saying this about Jamie Foxx, but cocaine or methamphetamine can easily cause strokes. So what if it was something like that? I wouldn't want people to know that I did cocaine and then I had a stroke. You know, it would be embarrassing. It would be bad for my career. But what you're asking is the key point of what you're asking is that possible? And what I will say is that I've never seen that. But that sort of goes with the sort of it causes clots mentality. The problem with that being a prevailing conspiracy theory is that there's one thing that produces clots a lot more than anything else, and that's COVID-19 infection. That is far more likely to produce a clot and a heart attack, stroke, pulmonary embolism than a vaccine or even a medication or anything. COVID-19 is probably will go down in the history of human infections as the most thrombogenic, meaning causing clots, infection in the history of humanity. And frankly, it makes me very sad that this virus arose because, I definitely do not want a stroke, heart attack, or pulmonary embolism. And that's what you get the risk of if you get COVID-19. Your risk of that spikes. People will yell and they'll say you're a liar, but here's the issue with that. I worked in 2020 doing autopsies, of course, and from early 2020 all the way to January 2021, we saw the most insane increase in pulmonary emboli, heart attacks, and strokes that you've ever seen. In fact, the number is actually 800%. We saw an 800% increase compared to the previous year. Well, what was going on during 2020? The pandemic. What wasn't going on? We didn't have vaccines or really any other good treatments for that virus. So it's very reasonable to assume that the virus was in fact causing the clots. So the answer is, I don't know anything about mRNA causing that, the vaccine causing that. It's more likely that a virus caused it, but it's even more likely that neither of those things are involved. I mean, the guy is not that young. He's in his 50s, right? 50-year-olds have strokes all the time. We don't know what his habits are. Maybe his blood pressure is 190 over 110. Maybe he does use illicit substances. Maybe he had an aneurysm and had a hemorrhagic stroke. So Dr. Drew is being a bit of a clown, and I would tell him that to his face. He's being a bit of a clown, and I don't think that you can. I don't really like to speculate too much when something happens to a celebrity like that. What I will do when that happens, and I have made videos like this, is that I will provide context based on the information that we have. And that's a lot of what I do over at TikTok, is I'll produce some context to kind of explain things. So you will see me make predictions or comments about that, but I don't go out on limbs too much. I mean, what Dr. Drew is talking about, and his guest or whatever, I mean, that's so far out on a limb, it's crazy. But you know what happens when you do that? You get millions of views. And when you get millions of views, what do you get? Lots of money. That's how the system works nowadays. All right, let me scroll back. In a case of suspected suicide, evidence of TXT suggesting they did it to themselves, how can you prove it was them and not a homicide made to look like a suicide? Well, you know, uh, well, first of all, were they alone? We've had many cases like this. So, for instance, let's say you've got a guy that sends a text. He says, "Goodbye, cruel world. I hate life. I'm going to kill myself." And we have a security cam footage at his apartment showing that nobody came in and nobody came out. And when police came to investigate, the doors and the windows were all locked. Um, it it's him. There's no question who did it. It's him. Now, was he with anybody else? Is there anybody who has anything to benefit? I mean, it's just like any investigation. Um, the circumstances matter, and that's how you prove it. Sorry. Okay. Couple more here. So Jamie Foxx is 55, not a spring chicken. I'm not that much younger than him, though. But I've seen strokes in the late 30s and early 40s, which were almost undoubtedly due to COVID during 2020 and 2021. I've seen a couple this year, actually. It's really scary, and people just have to be aware. They just have to be aware of their bodies. Am I having numbness? Am I having tingling? Am I having weakness? Am I having chest pain? Am I having shortness of breath? And let me just tell you, from my perspective as a forensic pathologist, what's the biggest thing I see? Shortness of breath, and this is not talking about stroke. This is talking about just related to deaths. Shortness of breath that goes ignored, and the person doesn't go to the doctor. They get short of breath with acute heart failure, short of breath with pulmonary embolism, short of breath with something like a developing aortic aneurysm. So if you are short of breath with no good reason for it, you need to get to medical care and see somebody for it, because that is the number one complaint. Is a man, he was feeling short of breath for a couple of days. He went to bed and his wife found him dead. And then you open him up and he's got a ruptured aortic aneurysm, or he's got a pulmonary embolism or something like that. So that would be my number one thing to watch out for. Chest pain is number two. Chest pain's tough because there's so many things that can cause chest pain that aren't dangerous. Costochondritis, pulled muscle, gastroesophageal reflux disease, stuff like that. And all of those cannot kill you, but can feel like a heart attack. So it's, panic attack, anxiety attack, things like that are really rough because you don't want to waste $4,000 going to an ER. But what I always say to people is the pain different than it's ever been before? And if it's different pain, that's when you need to think about seeing somebody, because your time frame is short. Your window is short for survival. Erica says, my mom had a stroke at 59 and she didn't know. Just knew talking to her on the phone. I told her boyfriend to call 911. I couldn't believe how careless he was. Yeah, and so that's a lot of what I'm seeing is you'll have spouses, boyfriend, girlfriend, married spouses, whatever, and they'll be like, oh, well, yeah, he had chest pain for 5 days and then he died. Well, why didn't you go see somebody? And so, yeah, people, and that's part of why I'm online. I'm trying to make sure everybody knows what to watch out for. I don't want anybody to die who shouldn't die. And we all go that direction, but nobody should have to die before their time due to simply not knowing that they should go. Now, it's easy for me to say, because I'm not considering the financial impacts. There's a lot of people who don't want to go to the doctor because of the financial element. You go to the ER and you get a bunch of tests run and you get a bill for $12,000. I mean, it sucks. I do think that the private insurance system, the healthcare system in this country is really harming people more than helping them, frankly. And even though single payer does have some some bad elements to it, or nothing's perfect. So once again, it comes down to you've got two not so great options, but one of them is less bad than the other. And that's how I feel about that. Erica says, my mom passed in October, and I'm sorry to hear that your mom passed in October and wasn't the same after her stroke. Yeah, unfortunately, that is often the case. What causes ganglion cysts in the wrist? How to get rid of them? Well, I think the only way to get rid of them is surgically. I mean, you have to just have them removed. As far as what causes them, I mean, I actually don't know really the pathology behind why they cause. I mean, usually it's just, most folks, it's just age, and cystic formation throughout the body increases with age, whether it's a cyst in the liver or the kidney. And most 60-year-olds that I autopsy have little cysts in their kidneys, some in their liver, some in their spleen, sometimes in the lung. And just like cysts can form cutaneously, you know, it's usually a factor of age. All right, I've been on here for a little bit, so let me do like one more question, one more comment, and then I'm gonna have to go do something like shoot basketball, or you know, swim, or ride my bike or something. And I'm starving to death. I need to eat too. But yeah, when I get my arcade game, you'll probably never see me again. I'm probably just going to be in there. I'm going to have like pizza and soda, and I'm going to get fat, and I'm going to just be playing my arcade game, and that's where they're going to find me. I'm going to just be like, you know, I'm going to be leaning forward on it, unresponsive. That's my goal. That's how I want to go out. So thanks for everybody being here. 37 minutes. That's pretty good. I'm enjoying it because I'm sitting on my porch, and I'm enjoying nature and breathing oxygen and not formaldehyde. Yeah, or play Zelda. She says, I definitely I haven't played it for a few days, and so I need to get back to playing it because I'm still on the Great Sky Island and I'm not doing well. Skyrim, and Skyrim came out. That's hilarious. Yeah, I do that sometimes. And I love that I'm going to actually have time in the future, starting in June, where, well, I think I'm going to have time, where when something new comes out, I can kind of immerse myself in it. Going back 35 years ago, when Zelda 2 came out, I was there for opening day. I got it. I read the book on the way home in the car. And I played it just endlessly for months on end. Months on end. I just absolutely loved that game. And back then, you couldn't Google how to beat a game. You had to just figure it out. Now, there's a YouTube video for everything. But I had to figure it all out pretty much on my own. That's why it took months. So, but anyway, thanks for everybody coming. I got to get my watch time up on YouTube so I can get monetized, so I can make videos and teach on here. Maybe do that for a living instead of exposing myself to deadly diseases and death threats every single time I go to work. Yeah, do a live playing the game. I've actually been considering streaming because, you know, I love video games. I just haven't been able to do it for a while. And I'm considering doing streaming. So I don't know if I'm going to do Twitch or just stream on TikTok or whatever. But I'm very excited about it. So anyway, have a nice day, and I guess it's Friday, so we've still got a whole weekend ahead of us, and who knows what might happen.